So let's move on to the second talk for today, the role of communication with patients to improve compliance by Dr. Sushmita Kaushik. Dr. Sushmita is a professor in the Advanced Eye Clinic, PGI Chandigarh. She is a passionate teacher and has more than 100 publications in peer-reviewed journals. She has been a reviewer for almost all reputed ophthalmology journals, including IOVS, Ophthalmology, Archives of Ophthalmology, AJO, BJO, IJO, and some others. She has held several leadership positions, including as former secretary of the GSI and is the founder secretary for the Indian Pediatric Glaucoma Society.
Okay, at the outset, thank you very much, AIOS and Dr. Sushma for having me on. And it's always daunting to present in front of Dr. GC sir, but I'll do my best. So the role of communication to improve compliance. And as we gray more and more, we realize that more often than not, the problem is that we haven't said what we assume the patient knows. So why it's important, especially for glaucoma, is because the nature and impact of glaucoma is not actually understood until it's too late. And patients are non-compliant. They do miss follow-up appointments. And at the heart of the problem is that it's asymptomatic before it reaches the advanced stage. So if you communicate effectively, it enhances the patient's understanding of their disease as well as their need for treatment. And that, we hope, may result in better compliance. So let's look at it from the patient's point of view. The problem is that mild to moderate glaucomatous optic nerve damage is usually asymptomatic. They were perfectly fine. They've gone for glasses and somebody has said that, look, it looks like you have glaucoma. And as the disease advances, these are things which they're not too easily explained to their doctor, but they do have difficulty with peripheral vision. They have difficulty with contrast. There's more glare. Their adjustments between light and dark become more difficult, and there's still clear central vision. So more often than not, they'll have a Snellen's acuity and somebody will tell them, oh, it's all fine, don't worry, have a vitamin tablet or something. It's only when it's severe glaucoma that it's total irreversible blindness, and that's when we've lost the battle. So the cornerstones of communication really is, I think, listening to the patients and not brushing aside 100% contrast Snellen's acuity, answering questions face to face and demonstrating the nature of the disease and its effects with maybe drawings and nowadays lots of photographs. So if you convince a patient as to what the problem is and what the problem could be if they're not compliant, that I think will make a difference. Now, at least in setups like ours and many others, the barriers are simply the lack of time, unregulated patient flow. It's all very well to say these things, to talk to them and spend time and all that. But we know, especially in tertiary care centers, that urgent patients and serious patients take up most of our time. So we don't bother with patients who we think are okay, but then there would be a time when they would not be okay. So if we want to reduce that, we might as well start communicating. So these are a little bit of strategies which we've learned along the way and probably might be helpful. So one is avoid asking a yes or no question. Are you putting your drops regularly? Will always elicit a yes, I'm putting my drops regularly. But if you think the patient is not compliant, one trick I've learned is to ask them straight on, so since when have you missed your dose? And usually this elicits days or even weeks that, oh, it was over and I had my appointment in the next week, so I thought I might as well show you before I bought a new medication and so on and so forth. So a simple check of the bottle and the amount of remaining drugs, if you ask them, when was this bottle bought? And if he said 3 weeks ago and it's nearly half full, you don't have to ask him anything else. The other thing is be alert to the signs of poor compliance. So you need to watch out and just ask. So if there is increased frequency of missed appointments, you must understand that a patient who's not serious about visits may not be serious about treatment either. The other thing is self-reporting. If the patient insists on saying, I'm very compliant, I always put my drugs, I never miss a single drop, you must remember something is wrong somewhere. And then, of course, lack of understanding of the disease. Everybody has very busy lifestyles. Oh, I had a meeting. Oh, I have to go here, there. And then let's not get away from the fact that there's dissatisfaction with the physician and long waiting times at clinics, which tells them that there's no point in really going there because after waiting for 4 hours, I'll be, seen off in 5 minutes and said, and be told everything is fine. There might be unstable family conditions, which we don't talk about because our patients are elderly, and there might be lots of issues with them being able to be in a position where they don't help themselves too much. So ascertain why your patient is non-compliant. Are there multiple comorbidities? Somebody on a wheelchair with multiple other things might think putting a drop in the eye is the least of his worries. Is there no support system at home? Is there a problem with the medication? Now this is so common. Sometimes the treatment is simply more troublesome than the disease, and they simply couldn't bother about putting too many drops. So these are just suggested steps to detect adherence. Begin with a direct, open-ended question. So tell me how you've been taking your medications, and the response will reveal their level of understanding. And a follow-up question would be, but you're so busy, how do you organize medication? And how do you remember to take them? Then change the patient's expectation that you'll be judgmental. Tell them that you know that non-compliance is universal. So you change the definition of a good patient, and you understand that there would be problems as well. So explain how information about adherence will affect decisions. So he says, if you tell them, look, your pressure is higher than it should be, but before we change the prescription, let's make sure that you've been able to use the medication you're already on. So that makes the patient understand that he might as well be truthful. Otherwise, you'll just have another bottle and another cost to it without really helping. Finally, ask about forgetting or missing medications if they do. In the post-op patient, what we've learned is never ever send a patient to the pharmacy with a list of drugs prescribed. There are too many times when we've seen patients put antibiotics 1 hourly and steroids 3 times a day if you wanted the other way around. Ask to get the drops, explain them, and helps to have the bottles marked with a pen for the frequency to be instilled. We just put little dots on it, and that helps. Tell the patient about time. This is something which I have in my clinic. And I tell them a 30-second interval has almost a 50% washout. A 2-minute interval has much less. But if you wait for 5 minutes, those 2 drops are likely to have no washout at all. I just like to share this. I can't resist not showing a baby. So this 6-week-old baby had a goniotomy done, and we thought we'd done a good job, and we called him back 5 weeks later, and he actually had exogenous Cushing's just with betamethasone 4 times a day bilaterally. So sometimes it's important. We forget that that drop meant for an 80 kg man is not enough for a 2.5 kg newborn as well. So we need to remember that and explain punctal occlusion and all that. Periodic interactions, we have this sadly just about twice a year, but they help very much. They show that we are as human as the patients are. And major gains of effective communication are to gain the patient's trust, and that's half the battle won. A patient understands what the disease is, why we are treating, how we are treating, and invariably leads to better adherence. Making friends with children and communicating with them makes them very good patients. The cause of concern is even in the best of centers, patients are infrequently listened to. This wonderful article I found by David Friedman in the analysis of videotaped encounters in community office practice showed that physicians spend an average of 8 minutes in the room with the patient and an average of 5.8 minutes talking to the patient. And if this is in the best of centers, I wonder what we do. So in a nutshell, it's key, more important in diseases like glaucoma. Tell the patient what to expect, educate them about what they should know, be involved, and care. Patients respond much better to a doctor who's concerned.